Hi, I'm Brenna Bray. I have a PhD in biomedical science and neuroscience. My postdoctoral training is in complementary and integrative health, focusing on eating disorders. My graduate training was funded in part by the National Institute of Health. My advisor had an R1 grant from the National Institute on Drug Abuse and Addiction. My postdoctorate training was funded directly by the National Institute of Health and specifically the National Centers for Complementary and Integrative Health. There's been a lot of talk recently about the impacts of processed foods and food environments and food industry practices on mental health and specifically in the eating disorder space. So I wanted to just share a little bit of information on that. First of all, my graduate work was in the impacts or exploring the impacts of stress hormones like cortisol on neurobiological processes that tend to be associated with addiction. We have a lot of research conducted in preclinical models, so animal models, as well as in human models, showing that exposure to foods that are either highly palatable or very salient or highly processed, these could be sugary foods, high fat foods, high salt foods, milkshakes, etc., activate the same reward responses in the brain that are associated with drug reward. So if you put an individual who has a binge type eating disorder in a scanner and you look at their brain activity and you give them a little bit of milkshake in their mouth or you show them an image of a milkshake, they will have rapid activation of the nucleus accumbens, which is the part of the brain associated with reward responses. And this occurs at the same magnitude as we would observe if we put someone who was addicted to cocaine in a scanner and gave them a little bit of cocaine or showed them images of drug paraphernalia. So we have this data showing that in a certain percentage of cases of individuals who have eating disorders, there is also this dysregulation in their reward neural circuitry. And that's the same dysregulation as we see in substance-related and addictive disorders. Now, again, that's not the case for all eating disorders, but that is true for a large percentage, is what we tend to see in research. I have some blog posts on that. I'll put links in the chat. But the thing I wanted to share today was specifically the impact on these processed food environments and predatory food tactics. So I'm going to share just a little bit of my work from a publication that I put out in 2022. I'm going to do a screen share here. And again, a big caveat, I'm not a social media influencer or content creator. That's not my jam, so this is going to be a little bit clunky. Please bear with. Thanks. Okay, so here we're seeing my 2022 publication entitled Binge Eating Disorder is a Social Justice Issue. It was a cross-sectional mixed methods study of binge eating disorder experts' opinions. So what we are really looking at in this publication were environmental factors that experts in the field tend to associate with binge eating disorder. And I'll just show a little bit some information that might be relevant here. Okay, so we developed this criteria to identify experts in the field of binge eating disorder. And we developed some criteria for experts on the research side, as well as experts on the clinical side. So folks who provide clinical care to individuals with binge eating disorder. That also included healthcare administrators. And then we had some dual criteria as well. I also wanted to be able to include nutritionists, dietitians, and then have an index on if you're just Joe Schmo on the street and you have binge eating disorder and you are kind of using Google or, the internet to identify care, who might you be directed to? So somewhere in here, I have the criteria that we used for that. But I'll just show this is kind of our Prisma diagram or a flow of our study. So using that criteria, we identified 38 experts. 18 experts met the research criteria. So this was based on publications in PubMed or PubMed indexed publications, federal funding related to eating disorders. On the clinical side, we had 18 participants who met the clinical criteria for being a binge eating disorder experts. This criteria included things like leadership in professional societies. And then we had 2 individuals who met our dual criteria, which just meant that they, we had some, if you meet a certain number of criteria in both categories, you could be included. So 38 individuals met that criteria. 14 of them consented to do 2-hour-long semi-structured interviews with me on Zoom. The interviews were recorded, but we began recordings after introductions. So all of the interviews are anonymous, they were transcribed, and then myself and one other researcher went through the transcripts and identified themes in the transcripts. I was the only person in the study who knew the identities of the participants. The other researcher who went through the transcripts for themes did not know the identities of the individuals. So that's how we protect anonymity. Um, and just a little bit about the demographics of these experts. So 8 of them, 62%, were fellows of the Academy of Eating Disorders. 62% had a PhD or were a Doctor of Science in SCD. 31% had a medical degree, so an MD. 31% were licensed or registered dietitians or registered dietitians certified in eating disorders. 15% were healthcare administrators. And then one each we had a certified chef, someone certified in intuitive eating specialist, a fellow of the American College of Neuropsychopharmacology. One had a Bachelor of Medicine chirurgical doctor, and one had a master's in public health. There's some additional demographics here. Most notably, 71% of our participants were residents of the United States of America, 14% were residents of the United Kingdom, one was a resident of Australia, and one was a resident of Canada. And the part that I want to go to here, one of the themes that we identified in all of the environmental factors that these experts spoke about, and actually I should scroll back up. So the most predominantly endorsed theme was systematic issues and systems of oppression. There was actually another theme that we've identified in a post-analysis that we didn't identify here that was invalidating environments or invalidation. And this could be related to so many different factors. If you're a child and you're not validated by your parent, if you talk about your eating disorder and you're not validated by your clinician, if you have a certain racial or ethnic or sexual preference or gender identity that causes you to experience invalidation in the world. These are all forms of invalidation that can increase the risk of developing an eating disorder. And this is what the experts express, but this is also demonstrated in the literature. Then the second theme, so systematic issues and systems of oppression. And just to give examples here, the examples that the experts gave were systematic discrimination, body weight, shape, size discrimination, structural racism, structural sexism, media messaging, and sociocultural ideals or mandates, perpetuating stigmatization, diet culture, movement or fitness ideals. So just a lot of different systemic issues that we have, again, in the US, but as well as in the United Kingdom, Canada, Australia, and then, globally as well, that experts associate with eating disorders. Now, the theme of interest, the reason why I created this post, was one of the themes that was like less predominantly talked about by researchers, and that was the theme of predatory food industry practices and environments. And that was theme 3.8 right here. So if you go to this publication, I'll put a link in the chat. This is on page 19 of 38. And let me see if I can just kind of zoom in a little bit here to make it a little bit easier. Okay, so this is in the results section, so just reporting on what the experts said. So 4 participants, 29%, described predatory food industry practices. This included hiring engineers to design foods that produce specific rewarding or emotional responses and promote consumption. And this could potentially lead to overconsumption or binge eating. And so this table kind of shows some examples here. So predatory food industry practices were described by 29% of experts. They described foods intentionally being designed to produce specific reward responses that promote excessive consumption. All 29 of the experts who discussed this addressed this theme. They made comparisons between big tobacco and big food industries, and I'll chat a little bit more on that in a second. They talked about food industry practices that were described as public policy issues. They talked about a need for a call to public education. They expressed views that disordered eating behaviors can be associated with specific foods, but that can also be extinguished. And they talked about rewarding food properties that were acknowledged, but they didn't, but not described as intentionally engineered. So there was a lack of consensus, on whether these foods were intentionally engineered to target overeating behaviors. So here's some examples. Quote, the question of political utility is something which we don't usually talk about in science, but I saw the nutritional epidemiology field paying attention to the emotional aspects of overeating and the emotional and physiological aspects of the way processed foods are created to promote overeating by tapping into physiological responses to fat, sugar, crunch, salt. There's so many processed foods that are being designed to get people to overeat or to trigger an emotional response that then makes someone prone to binge eating as a way of emotionally coping with things that are happening around them that feel out of their control or that are damaging to them. There's so many different systems. The food system is really just one of them. The food industry and generation of processed foods are part of the landscape that aids and abets binge eating and binge eating disorder. They impact what the food landscape looks like, and there's people profiting off of that. During the past 42 minutes, there are companies and individuals profiting off of making food that will lead someone down a path to binge eating disorder or binge eating. If that's not a system of oppression, I don't know what is. So that's a larger quote by one of the experts in the field. This was often identified as an issue of political utility and public policy. Comparisons were made between big food and big tobacco. One participant specifically noted with tobacco, we were working on these treatments and pharmacology and all these sorts of things, and we really didn't start to see drops in tobacco use until we changed the tobacco environment. Leaning on a public health perspective, what have we done to reduce people's tendency to overuse things like tobacco or with alcohol too? We really focused on altering the environment. So that's not as much marketing. There's not as many triggers. It's not as in your face. It's not in vending machines. It's not targeted to kids. It's more expensive. And so I think all of those environmental interventions, if you can have a more optimal environment that encourages healthy eating, and there's not as much temptation that allows our individual treatments to have a better chance of success. Because if you're trying to use individual treatments to combat a truly oppressive food environment, that's a really tall order. That was a quote by another one of the experts in the field. One participant also advocated for the importance of informing individuals with binge eating disorder, and more broadly, of the nature of these foods or food industries and, quote, what they're up against to alleviate the sense of failure and guilt that often accompanies binge eating these foods. So the quote by one participant, to ignore the fact that the food environment has changed and that we are all kind of dealing with predatory food industry practices, but with very hyper-engineered, highly rewarding foods. To not acknowledge that in any way is problematic. And I think not giving people the full picture of what they are dealing with. If you're sitting down with a bowl of ice cream and a bowl of salad, you're dealing with fundamentally very different things from a reward perspective and even a psychological profile. And so it's not just that if you tried hard enough, you'd just be able to sort this out very easily. Underselling the challenge of our food environment and the foods that we're dealing with, especially for those who are under-resourced, is not giving people the full picture. And then I want to scroll down in section 4.8. So now this is the discussion section of this manuscript. 4.1.8. I again addressed the theme of predatory food industry practices. And here I kind of related what we heard experts talking about as compared to what we're seeing in the literature. So, a minority of experts recognized food industry practices being designed to manipulate consumer choices. 21% of experts who I interviewed identified this. This is proportionately underrepresented in peer-reviewed journals and in the popular press. So this topic is represented in the literature, but not to the same extent that it actually occurs in real life. Experts and the literature recognize that food environments and manufacturers can and do leverage food decisions by influencing variables known to control consumption that can also result in binge eating. So, for example, marketing, packaging, container shape, portion size, product salience, hedonic factors like salt, fat, sugar, structure, texture. Literature also recognizes similarities in deceptive tobacco and food industry marketing practices. So, for example, intentionally emphasizing personal responsibility, paying research scientists to criticize opposing research as quote unquote junk science, lobbying with quote massive resources to stifle government action, quote, manipulating and denying the addictive nature of their products, and marketing to children to capture lifelong consumers, right? We saw this being done in the tobacco industry, and we are now seeing it being done in the food industry. More recent findings identified direct tobacco industry involvement in food marketing strategies that were not recognized by the experts who I spoke with, but they are recognized in the literature. And I actually only addressed just the tip of the iceberg of these in this publication. So, for example, R.J. Reynolds owns Hawaiian Punch. Philip Morris owns Kool-Aid, Capri Sun, Tang, and General Mills and Kraft Foods. And Philip Morris directly transferred expertise, personnel, and resources from its tobacco subsidiaries to its food subsidiaries, creating a racial and ethnic minority targeted food and beverage marketing program that was modeled on its success in cigarette programs. So essentially, what we saw in the tobacco industry was in around the 80s and 90s when we began to recognize that tobacco use was associated with all of these negative health implications, lung cancer, throat cancer, etc. We began to invest at a national level. The federal government, the National Institute of Health, began to invest millions, if not billions of dollars into research that could develop and test interventions that could be used to promote smoking cessation. We didn't see, and the implication there, that was placing the responsibility on the individual, right? You got yourself into this mess. We'll give you the interventions, but it's your job to get yourself out of it. We didn't see tobacco use rates change until we started taking responsibility for it as a public policy issue, as a public health issue. So we didn't start to see tobacco use rates change until we started regulating the environment that tobacco use occurs in. So once we started making policy changes and saying, Joe Camel, you are directly targeting to kids. You know that if you get a kid using your product, they will be addicted for life and you will capture a lifelong consumer. That's a fantastic business model, but it is at the expense of personal and public health, right? And who pays for those health implications? Not the tobacco companies. Medicare, Medicaid, personal individuals and families, they pay for the health expenses that are associated with the repercussions of tobacco use, right? So the tobacco companies are profiting and they're escaping the repercussions. Once we started making this a public policy issue and said, you can't target to kids, that's public policy issue done. You can't do that. You can't have tobacco vending machines everywhere. You can't have signage and, marketing in people's faces. If someone is trying to stop smoking and pre-COVID, they drive to work, and on their drive to work, they pass 5 billboards where they are in their periphery, where they are the most susceptible to advertisement. They see images of people smoking. The first thing they do when they get to the parking lot is pull out their pack of cigarettes and light up, or walk inside and go to a vending machine and get a pack of cigarettes and light up, right? So we needed to remove that marketing to help eliminate the craving. Because you know what? These companies, they know what they're doing. They're hiring people with PhDs in neurobiology, neuroscience, addiction, just like me, who know how to manipulate the brain reward system and help them design products and marketing campaigns that are going to be specifically targeting and increasing risk for addiction to these products. Great business model at the expense of public health. And now we're seeing the same thing being done in our food, but it is so systemic that it is very hard to recognize. So, for example, sugary cereals, kids cereals, right? Who are they marketing to? They're marketing to kids. If you've got a kid eating your product, you've got a consumer for life. We know that you're going to dysregulate their taste buds, their taste expectations. We know that you're going to dysregulate their reward circuitry. So they are going to be prone to higher rewarding products, more salient, more stimulating products. And that actually shifts not just their taste preference, but their food choices for life. They are going to shift and be more prone to choosing more stimulating foods. And they are going to be less prone to eating real foods, real fruits, real vegetables, real nuts, seeds, grains, right? Because those foods don't have the same rewarding properties as these processed foods do that are designed to hit our reward systems, one, at a much greater magnitude than real food, and two, often at a magnitude that is greater than the neural ability to self-regulate, right? So these foods are designed to hit our reward systems at a magnitude that is above the level that we can control with our own brain circuitry. They are designed to be addictive. They are designed so that we will overeat them and so that we will keep overeating them, right? And who profits from that? The food industries profit from that. Who pays the repercussions of that? We do. Our mental health, our physical health. We know that processed food consumption increases inflammation. That results in neuroinflammation that prompts depression and anxiety. There are other mechanisms that facilitate too. We know that processed food consumption alters the microbacteria that live in our guts, and we know that that facilitates depression, anxiety, addiction. We know that these foods facilitate overweight and obesity, diabetes, heart disease. They put us at risk for these health disorders at a minimum. And oftentimes they contribute to it or have a causative role. And we pay the repercussions of that, both physically and fiscally. When we go to get medical treatment, we pay the Medicare bills or Medicare, Medicaid, our health insurance does, right? The food companies don't. They're getting the profit and they're avoiding the repercussions, right? So this is a really big issue. So I'm going to keep reading here. This depth of tobacco and food industry involvement highlights some of the ways that oppressive tobacco and food systems directly target racial and ethnic minorities specifically, as well as sex and gender subpopulations, as well as really honestly anyone. And this possibly contributes to the systemic oppression that can increase the risk for developing binge eating disorder, as well as other eating disorders and mental health issues and physical health issues. Also, the literature, but not the experts, identify food industry efforts to influence nutrition research and professional activities through forming and funding science founding research institutes and journals used to develop and publish industry supported studies and industry benefiting guidelines on scientific integrity, conflicts of interest, and public-private partnership, thus shaping the nature of the science that drives public policy to its benefits. So let me break that down for you. In research, anytime we conduct research and go to publish it, we are required to publish in every publication we put out a statement of financial disclosures. I have one here in this publication. I'll show it at the end. I did not have any financial disclosures, any conflicts of interest to disclose. But for example, if I were being paid by Coca-Cola, I would have to list that in my conflicts of interest and financial disclosures, that I am being paid by Coca-Cola and that may influence the work that I'm doing, right? There are a lot of journals that have very specific policy around conflicts of interest. High impact journals oftentimes might have policies stating that if you have a very significant financial disclosure or conflict of interest, they will not publish your work because there's a very large risk for bias. So food companies have founded their own science sounding universities and institutions to make it sound like these people, and then they can pay these people indirectly through these institutions. So perhaps someone might be working for, I can't remember the name offhand. I wish I could. The Food Research Institute, which was founded by Coca-Cola. Then in their financial disclosures, they can say, I receive salary funding from the Food Science Institute, rather than saying, I receive my salary from Coca-Cola, right? So that's one level of deception that occurs in the food industry. An additional level is that food industries have also created their own science sounding journals. So there's like a journal of nutrition that is owned by a food company, and I may be Coca-Cola. I'm not positive though. So I'm not knocking Coca-Cola specifically here. But so there are journals like, let's just say, for example, the Journal of Nutrition, I'm just making that up, that are owned by food companies. Let's just pretend Coca-Cola, again, making that up. And those journals will publish research regardless of the conflicts of interest, right? And they're taking it one step further. Those journals are also publishing articles that are trying to change policy around conflicts of interest. So those journals are also publishing articles saying it should be okay to publish research even if there's a conflict of interest. That should be allowed. Now, on the one hand, you can make a strong case for freedom of speech, right? So this is a very complex issue, but it is something that is worth being highlighted. So, one thing that I'm a very strong advocate of is, especially in the social media space, so many people who I talk to, my clients, my family members, my friends, say that they get their news from social media, right? And social media is not peer reviewed. There aren't really these regulations. So really anyone can say anything. They can say, oh, I'm an expert, when really they're, just trying to make ad funding. They're being paid by a company, right? So I'm a very strong advocate of actually deferring to the research, going on PubMed and reading peer reviewed publications, right? Publications that have been reviewed by PhD researchers for their research validity, their research ethics, or research conducts, by folks who are trained like me, who've gone through like 6 years of training in these research methods so that we know what to look for and we can ensure research validity. It's not a perfect system, but it's better than nothing. And there's a real risk here now when you have food companies who are creating their own science sounding institutions and science sounding journals, that risks kind of reducing the validity of our entire research structure. So it's an important issue and one that I really do believe needs to be a public policy issue. So just to wrap off with this section, these practices are important to address because they influence food consumption in ways that can result in binge eating, and specifically because they are not recognized by the majority of experts, suggesting they may not be known. Thus, the experts' call for public education and policy change around food industry practices seems particularly imperative. And one observation that I will share in doing this research, there was a lot of conflicted consensus around the concept of food addiction. Is that really a thing? What does that really mean? One thing that I observed was the individuals who I interviewed who made statements like, I don't really know if food addiction is real or food addiction is not real. I've seen people who say they're addicted to food, but then they are able to normalize. They are able to, regulate their consumption of certain foods. Those people tended to not have backgrounds or training in research. They tended to not be familiar with the very, very large body of research that we do have, showing that, in fact, a large percentage of folks with eating disorders, they do have the same dysregulated neurobiological systems in their brain as folks who have substance-related and addictive type eating disorders. Now, there's another implication, and that is just the basic fact of like what the word addiction means. Now, the word addiction is one that traditionally we don't use in the clinical space. We used to not see it being used in the Diagnostic Statistical Manual, the DSM, which is how we diagnose mental health illnesses. we used in the DSM-4 in the fourth edition, we had substance use disorders. And it wasn't until the publication of the fifth edition of the Diagnostic Statistical Manual in 2013, the DSM-5, that category was changed to substance-related and addictive disorders. Prior to that, the word addiction itself really wasn't used in the clinical space in diagnoses. We had a diagnosis for substance use disorder, but not addiction. In the preclinical space, so in research that's more concerned with basic sciences, how brain systems work, not so much diagnosing, the word addiction is used, quite frequently, because the implications are different, right? So in the preclinical space, when we use the word addiction, we're usually just talking to the way that brain circuitry can get dysregulated as a result of being exposed to hyperstimulation of certain sorts. And this can be, drug use. This can be hyperpalatable food or hyperstimulating food use. We can see this in pornography, in sex, gambling, a variety of different things. And as a neurobiologist, I can tell you that dopamine release in this brain region, the nucleus accumbens, tends to be what is associated with reward responses. And at a very central level, when we're thinking of what we might call an addiction, we're generally referring to dysregulated dopamine responses in the nucleus accumbens. And we know that these can occur not just in response to substances or drugs or alcohol, but also in response to behaviors, right? So if you, for certain people engaging in sex or, watching pornography, can produce these hyperdopaminergic responses in the nucleus accumbens that can dysregulate the system. And we see the same thing with food, right? So there's a little bit of, that's a very nuanced landscape. And there's really a lot to factor. I'm oversimplifying it by far, but the word addiction can be a little bit controversial. The bigger question, I think, in that space is the question of if it is true that folks can have a addiction or an addictive-like relationship with certain foods or components of foods or eating behaviors, then there's this question of what does that mean for treatment, right? In alcohol, in drug use, we tend to see that actually the most effective treatment is a 12-step intervention, Alcoholics Anonymous, which endorses abstinence. And abstinence, of course, is not that simple when the addictive relationship is to food. You can't simply abstain from eating. So what one possibility is folks who identify as alcoholics and work in the 12-step space, they will say, well, I can drink, I just don't drink alcohol, right? I drink foods that don't have this reward response to me. I can drink water, I can drink, tea, etc. I just don't drink alcohol. So that's one possible approach that can be taken in the eating disorder space, right? We don't abstain from eating, but we can have a little bit of awareness around what are those foods where when I consume them, they seem to override my ability to self-regulate my reward responses. And maybe those are the foods that we want to stay away from. Right now, again, the field is very nuanced and eating disorders are very heterogeneous. There are a lot of different pathologies. I think the food piece is just one piece of this much, much larger issue. So I'm just offering that a little bit of that towards the end is my own just kind of 2 cents and observation, but I just wanted to offer what the research does show on predatory food industry practices. Hope this is helpful. I'll do a little here, stop screen share. Great. Hope this is helpful. Thanks so much.